You've noticed it. The way your legs feel heavy by the end of the day, the aching in your calves when you walk more than a block or two, the coldness in your feet, even when you're wearing socks in a warm room, the cramps that wake you up at night, sudden and painful, gripping your calf muscles until you have to get up and walk it off. And maybe you've noticed something even more concerning. The way walking uphill or climbing stairs leaves you breathless and forces you to stop. Not because your lungs can't keep up, but because your legs simply won't. They burn, they ache, they feel starved for something they're not getting. And if you've mentioned any of this to your doctor, chances are you were told it's just circulation, just your age, or maybe it's peripheral artery disease, and there's not much to be done except take a statin, maybe add aspirin, and accept that this is what 70 looks like. But here's what almost nobody tells you. Those symptoms, that heaviness, that pain, those cramps, that coldness, they're not inevitable. They're not just age. They're a direct signal that your leg muscles are not getting adequate blood flow and oxygen. And the reason for that inadequate flow is often not blocked arteries, though that can contribute. The deeper reason, the one that's correctable and almost never addressed, is that the tiny blood vessels inside your muscles, the capillaries and arterioles that deliver oxygen to the tissue, have become stiff, constricted, and dysfunctional. And there's one vitamin, one specific nutrient that's been studied for decades in relation to blood flow, circulation, and vascular health that the majority of people over 60 are deficient in without even knowing it. And when that deficiency is corrected, when you restore adequate levels of this vitamin in your system, blood vessels relax, blood flow improves, oxygen delivery increases, and symptoms like leg pain, cramping, coldness, and exercise intolerance often improve dramatically. Not overnight, not magically, but measurably, consistently, and in many cases powerfully enough that people who thought they were headed toward limited mobility, or even amputation in severe cases, regained function they thought was gone forever. This isn't alternative medicine. This isn't a miracle cure being sold by someone with a financial interest. This is evidence-based, peer-reviewed, published science that's been replicated in multiple studies across different populations. And yet, most people over 60 have never heard of it. Most doctors don't check for this deficiency routinely. And most people suffering from poor circulation in their legs have no idea that a simple, inexpensive vitamin taken consistently could make a profound difference in how their legs feel, how far they can walk, and how much independence they maintain in the years ahead. In my years of practice, I've watched this transformation happen over and over. Someone in their late 60s or 70s comes in complaining of leg pain, cramping, and difficulty walking. Their doctors have checked for blockages, maybe found some mild plaque, started them on medications, but the symptoms persist. We check one blood test that hardly anyone orders. The deficiency is profound. We correct it, give it time to work, and within weeks to months the cramping stops, the pain lessens, the walking distance increases, and they tell me they feel like they have their legs back. Same person, same arteries, different vitamin level, completely different quality of life. And before I tell you what this vitamin is, do me a quick favor. If you want videos that actually explain what's happening in your body and give you real actionable tools instead of just telling you to accept decline, hit subscribe, give this a like, and leave me a comment telling me your age and whether you've experienced leg pain, cramping, or coldness. I read every comment, and your answers help me understand what's not being explained clearly in those 10-minute doctor visits. All right, let's get into it. The vitamin I'm talking about is vitamin K2, not vitamin K1, which is found in leafy greens and is important for blood clotting. Vitamin K2, which is a completely different form with completely different functions in the body, and it's the one almost nobody knows about and almost nobody is getting enough of. But before I show you exactly how K2 improves blood flow to your legs and how to use it, you need to understand what's actually happening inside your leg muscles and blood vessels as you age, because once you see the problem clearly, the solution will make perfect sense. Your leg muscles, like all muscles, are fed by a network of blood vessels. Large arteries bring blood down from your heart. Those arteries branch into smaller arterioles, and those arterioles branch into tiny capillaries, which are so small that red blood cells pass through them in single file. It's at the capillary level where oxygen and nutrients are delivered directly to the muscle cells. When you're young and healthy, those blood vessels are flexible, open, and responsive. When your muscles need more oxygen, like when you're walking or climbing stairs, the vessels dilate, widen, and allow more blood to flow through. But as you age, especially after 60, several things go wrong. First, the walls of those blood vessels become stiffer and less elastic. Second, they develop calcium deposits that make them rigid and unable to dilate properly. And third, chronic inflammation and oxidative stress damage the endothelial lining, the inner layer of cells that controls whether vessels stay open or constrict. The result is that even if your large arteries are relatively clear, even if you don't have major blockages, the small vessels in your muscles can't deliver adequate blood flow when your legs need it. So when you start walking, your muscles cry out for oxygen, but the vessels can't widen enough to meet the demand. The muscles become starved, they switch to anaerobic metabolism, lactic acid builds up, and you feel pain, cramping, heaviness, and fatigue. You have to stop and rest. The pain eases because the oxygen demand drops, and then you try again and the cycle repeats. This condition has a name when it's severe. It's called intermittent claudication, and it's a hallmark of peripheral artery disease. But even in milder forms, even before it reaches the level of a formal diagnosis, millions of older adults are walking around with stiff, calcified, poorly functioning blood vessels in their legs, and they're suffering symptoms that could be improved if someone just explained the mechanism and offered a solution. So here's where vitamin K2 comes in, and the science here is both elegant and powerful. Vitamin K2's primary job in the body is to regulate where calcium goes. It activates specific proteins that take calcium out of soft tissues where it doesn't belong, like your blood vessels, and directs it into hard tissues where it does belong, like your bones and teeth. One of those proteins is called matrix glay protein, or MGP, and it's one of the most powerful inhibitors of vascular calcification we know of. When you have adequate vitamin K2, MGP is activated, and it prevents calcium from depositing in your artery walls. Your vessels stay flexible and elastic, but when you're deficient in K2, which the vast majority of people over 60 are, MGP stays inactive. It can't do its job. And calcium, which is circulating in your blood and which your body is trying to manage, starts depositing in your artery walls instead of being properly regulated. Over years and decades, those deposits build up, stiffen the vessels, and create exactly the kind of rigid, non-responsive circulation that causes leg pain, cramping, and poor blood flow. And here's the part that should make you both hopeful and frustrated. This process is reversible, at least partially. Studies have shown that when you supplement with adequate vitamin K2, you can activate MGP, halt the progression of vascular calcification, and in some cases even reduce existing calcium deposits in blood vessels. The vessels become more flexible. Blood flow improves, and symptoms related to poor circulation often improve along with it. Let me show you the research because I don't want you taking my word for this. I want you to see the evidence. One of the landmark studies was published in the journal Thrombosis and Hemostasis. Researchers gave vitamin K2 supplements to older adults with vascular stiffness and measured arterial flexibility before and after. The group taking K2 had significant improvement in arterial elasticity over the course of the study, while the placebo group showed continued stiffening. The effect was dose-dependent, meaning the more K2 they took, the better the improvement, up to a point. Another study, this one in the Journal of Nutrition, looked specifically at people with peripheral artery disease, the severe form of leg circulation problems. The participants taking vitamin K2 had measurable improvement in walking distance, reduction in leg pain, and improvement in objective measures of blood flow compared to those not taking it. The improvement wasn't instant. It took weeks to months, but it was real, measurable, and consistent. And there's a large population study from the Netherlands called the Rotterdam Study that followed thousands of older adults for years and tracked their vitamin K2 intake through diet. The people with the highest K2 intake had dramatically lower rates of vascular calcification, lower rates of heart disease, and better overall vascular health compared to those with the lowest intake. The relationship was clear and strong. So why isn't everyone talking about this? Why isn't your doctor checking your K2 level and recommending supplementation? There are a few reasons. First, there's no standard blood test for vitamin K2 that's routinely available or covered by insurance. The tests exist, but they're specialized and expensive. Second, Vitamin K2 deficiency doesn't cause immediate, obvious symptoms the way a vitamin C deficiency causes scurvy. It causes slow, silent damage over years and decades, and by the time the symptoms appear, most doctors attribute them to age or artery disease, not vitamin deficiency. And third, there's no pharmaceutical money behind vitamin K2. It's a vitamin. It's not patentable. There's no marketing budget pushing doctors to prescribe it. But the science is clear. Most people over 60 are deficient, and that deficiency is contributing directly to vascular stiffness, poor circulation, and the leg symptoms so many older adults suffer from. Now let me show you why this deficiency is so common, because it's not that people aren't trying to eat healthy. It's that vitamin K2 is found in very few foods, and the foods it's found in are not part of the typical Western diet. Vitamin K1 is abundant in leafy greens, and most people get adequate K1, but your body is not very efficient at converting K1 into K2. Some conversion happens, but not nearly enough to meet your needs, especially as you age. Vitamin K2 is found naturally in fermented foods and animal products from animals that ate grass, not grain. The richest source is a Japanese fermented soybean dish called natto, which contains extraordinarily high levels of K2. But almost no one in the Western world eats natto. It's an acquired taste, and it's not readily available. Other sources include certain aged cheeses like Gouda and Brie, egg yolks from pasture-raised chickens, liver and butter from grass-fed cows. But even those foods contain much smaller amounts than natto, and most people aren't eating them regularly or in sufficient quantity. On top of that, if you're taking a statin, which millions of people over 60 are, statins interfere with vitamin K2 metabolism and can worsen deficiency. If you're taking warfarin or another blood thinner, you've likely been told to avoid vitamin K entirely, which is outdated advice that I'll address in a moment. And if you have any degree of gut dysfunction, which becomes more common with age, your ability to absorb fat-soluble vitamins like K2 declines, so you end up with a perfect storm. Low dietary intake, poor conversion from K1, medication interference, age-related absorption issues, and decades of deficiency silently calcifying your arteries and stiffening your blood vessels while nobody checks and nobody treats it. Now let me show you exactly how to use vitamin K2 to improve circulation in your legs, and I'm going to give you the specific form, dose, timing, and precautions you need to know. The form of vitamin K2 that's been studied most extensively and shown the best results is called MK7, which stands for menaquinone 7. It's the long-acting form of K2, and it stays in your bloodstream longer and activates MGP more effectively than the other forms. The dose that's been shown to be effective in clinical studies for vascular health is between 100 and 200 micrograms daily. Some studies have used doses as low as 90 micrograms with benefit, and some have used up to 360 micrograms in people with severe calcification. For most people over 60 looking to improve leg circulation and prevent further vascular stiffening, 100 to 200 micrograms of MK7 daily is a reasonable, evidence-based dose. You take it with a meal that contains some fat, because K2 is fat-soluble and needs fat for absorption. Take it at night with dinner or with a snack that includes a little cheese, nuts, or avocado. Consistency matters more than timing. This is not a vitamin you take occasionally. This is something you take every single day for months and years, because the benefits build over time as your body gradually activates MGP, clears calcium from vessel walls, and restores vascular flexibility. Now, let me address the important precautions, because there are some, and you need to know them before you start. First, if you're on warfarin or Coumadin, talk to your doctor before taking vitamin K2. The old advice was to avoid all vitamin K if you're on warfarin because vitamin K can interfere with how the drug works. But newer research suggests that taking a consistent, moderate dose of K2 daily may actually stabilize INR, the blood test that monitors warfarin, better than avoiding K entirely. The key is consistency. If you're going to take K2, take the same dose every day so your doctor can adjust your warfarin dose accordingly. Don't take it some days and skip it others. That's what causes INR to swing unpredictably. Second, vitamin K2 works synergistically with vitamin D and magnesium. All three are needed for proper calcium regulation. Vitamin D helps you absorb calcium from food, magnesium helps activate vitamin D, and K2 directs where that calcium goes. If you're taking high-dose vitamin D without adequate K2 and magnesium, you can actually worsen vascular calcification because you're absorbing calcium but not directing it properly. So ideally, if you're supplementing K2, make sure you're also getting adequate vitamin D, at least 1,000 to 2,000 IU daily, and magnesium, 300 to 400 milligrams daily, of a well-absorbed form like magnesium glycinate. Third, vitamin K2 is extremely safe. There's no known toxicity even at high doses. It doesn't cause blood clots, it doesn't thicken your blood, it regulates calcium, that's it. The only people who need to be cautious are those on warfarin, as I mentioned, and even then, it's about coordination with your doctor, not avoidance. And fourth, be patient. This is not a quick fix. You're not going to take K2 for a week and have your leg pain disappear. Vascular calcification took years or decades to develop. Reversing it, or even halting it and allowing vessels to become more functional, takes months. Most studies showing benefit ran for at least 3 months, and some for a year or more. The people who see the best results are those who commit to taking it consistently for the long term. Now let me tell you about a patient I'll call Frank, because his story captures exactly what's possible. Frank was 71 when I met him. He'd been a runner in his 50s and 60s, but over the past few years he'd developed severe cramping and pain in his calves whenever he tried to walk more than a few hundred feet. He'd seen a vascular surgeon. They'd found some mild plaque in his leg arteries, but not enough to explain the severity of his symptoms. He was on a statin, on aspirin, and told to walk through the pain, which he tried, but it was unbearable. He came to me frustrated and scared because he loved being active and he felt like his body was betraying him. We checked his vitamin D, which was low. We checked his magnesium, also low. And I explained the role of vitamin K2 even though we couldn't test his level directly. We started him on 200 micrograms of K2-MK7 daily, along with 2,000 IU of vitamin D and 400 milligrams of magnesium glycinate. I told him to give it 12 weeks and track his symptoms. Within 6 weeks, he told me the nighttime cramping had stopped completely. Within 3 months, he could walk half a mile before the pain started, which was double what he could do before. Within 6 months, he was walking 2 miles most days without stopping, and the burning in his calves was almost entirely gone. His vascular surgeon rechecked his circulation with an ankle brachial index test, a measure of blood flow to the legs, and it had improved measurably. Was it all the K2? Probably a combination of the K2, the vitamin D, and the magnesium working together to restore vascular function. But the point is, it worked. And it worked without surgery, without additional medications, and without side effects. 2 years later, he's still taking the supplements, still walking daily, and still grateful that someone finally explained what his legs actually needed. Now, let me give you additional strategies to maximize the benefit of K2 and support healthy blood flow in your legs, because K2 alone is powerful, but it works even better when combined with other evidence-based approaches. First, if you can tolerate it, add natto to your diet a few times a week. It's the richest food source of K2 by far, and even a small serving provides more K2 than a supplement. You can find it in Asian grocery stores or order it online. Mix it with rice, soy sauce, and mustard to make it more palatable. If you absolutely can't stomach natto, focus on aged cheeses and pasture-raised eggs as secondary sources. Second, eat foods rich in nitrates, like beets, arugula, and spinach, which convert to nitric oxide in your body. Nitric oxide is the molecule that tells blood vessels to relax and open. Combined with K2, which keeps the vessels flexible, you're addressing circulation from 2 angles. A small glass of beet juice or a serving of greens daily can significantly improve blood flow to your legs. Third, move consistently. Walking is one of the best things you can do for leg circulation. It stimulates blood flow, strengthens the vessels, and encourages the growth of new capillaries, a process called angiogenesis. Start with what you can do, even if it's just 5 minutes, and build gradually. The combination of improved vascular flexibility from K2 and the stimulus of regular movement creates a powerful synergy. Fourth, address inflammation. Chronic inflammation damages blood vessels and drives calcification. Reduce processed foods, especially processed meats and refined carbohydrates. Increase anti-inflammatory foods like fatty fish, olive oil, nuts, and colorful vegetables. If inflammation is high, consider adding curcumin or omega-3 supplements under your doctor's guidance. And fifth, stay hydrated. Dehydration thickens your blood and makes it harder for your heart to pump blood to your legs. Drink water throughout the day, especially if you're on diuretics or blood pressure medications. Let me pull all of this together, because this is the part that determines whether the next 5 or 10 years of your life include active movement and independence, or whether they include limited mobility, pain, and progressive decline. Your legs are not failing because you're old. They're struggling because the blood vessels feeding your muscles have become stiff, calcified, and unable to deliver adequate oxygen when you need it. And the primary driver of that stiffness is calcium depositing in vessel walls, because you don't have enough vitamin K2 to regulate where calcium goes. The solution is not more medications. It's not accepting limitation. It's providing your body with the specific nutrient it needs to activate the proteins that keep calcium out of your arteries and direct it into your bones where it belongs. And that nutrient is vitamin K2, MK7, 100 to 200 micrograms daily, taken consistently with adequate vitamin D and magnesium for months and years. This is not a miracle. This is biochemistry. This is giving your vascular system what it's been missing and allowing it to heal and function the way it was designed to. And the people who do this, who commit to it, who give it time, often see their leg pain decrease, their cramping stop, their walking distance increase, and their quality of life transform. So here's your action plan. First, this week, buy a high-quality vitamin K2 MK7 supplement. Look for one that's at least 100 micrograms per capsule from a reputable brand. Make sure it says MK7, not just vitamin K2. Second, start taking it every night with dinner or a snack that contains fat. Do this every single day. Third, add vitamin D and magnesium if you're not already taking them. Fourth, track your symptoms. Write down how far you can walk before pain starts. Note the frequency of cramping. Record how your legs feel. Do this weekly. And fifth, give it 12 weeks. Then reassess. If your symptoms are improving, keep going. If not, talk to your doctor about whether the dose needs adjusting or whether there are other factors to address. Your legs want to work. They're designed to carry you, to move you, to keep you independent. Give them what they need and they'll respond. You're not too old. Your circulation is not beyond help. But time matters and action matters. Start today. Now, everything we've talked about today is about improving blood flow to your legs. But there's one common medication that millions of people over 60 take, and it's silently making circulation worse by depleting the exact nutrients your blood vessels need. I made a video explaining what that medication is and what to do about it. I'll put it right here. Go watch that next, and I'll see you there. This is Dr. Robert Chen, looking out for you.